You ever wonder why your friend is paying $0 for the same medication that cost you $95? Or why your pharmacy tells you that they need to call your insurance first before they can fill your prescription? Well, that's the formularies at work. In this video, I'm going to explain to you what a drug formulary actually is, how it affects what you pay, and the three important terms you need to know about step therapy, prior authorization, and quantity limits. By the end, you'll know exactly what you need to look for so you don't overpay for your medications or get caught by any surprises at the pharmacy. Hello, my name is Edwin John Rodriguez, your licensed health insurance representative. And on this channel, we discuss all things health insurance with a focus on Medicare and ACA plans. Since 2007, I've had the pleasure of helping thousands of clients understand, compare, and enroll plans based on their specific needs and goals. Now let's get into it. So, what is a formulary? A formulary is just a list of medications your insurance plan chooses to cover. And even though all classifications of medications are required to be covered, not all of the same brands of medications are required to be covered on that same plan, which is why it's important to make sure you pick the coverage that truly represents you. Every health insurance plan has its own list, and they're not all the same. And one plan might cover one specific blood pressure medication, while another plan might not. And even if both do, they could charge you two very different prices. Now, there are some exceptions to this, which we'll cover later in the video, but in most cases, you want to make sure that any medications that are important to you are covered on the plan in which you enroll. Formularies are organized into drug tiers. Inside the formulary, medications are sorted into 5 tiers, kind of like shelves. The lower the tier, the lower the copayment. Tier 1 medications are known as preferred generics. Generally, these are going to be your lower cost medications between $0 and $5. You have tier 2 medications, which are your non-preferred generics. Those are generally going to be between $0 and $10. You have your tier 3 medications, which are considered your preferred brand name drugs. A lot of times, these are the ones you'll see on TV commercials, which will also include tier 4 medications as well. Those are your non-preferred brand drugs. Between the tier 3 and tier 4, those are generally going to be moderate to higher copayment medications. And on certain plans, it might even be a percentage. And finally, we have tier 5. These are your specialty medications, generally going to be considered your expensive ones. So for example, let's say you take rosuvastatin. It's a very popular drug, which is a generic for Crestor. On one plan, it might be a tier 1 copayment for just $0. And on another plan, it might be a tier 3 copayment, $47. Same drug, very different price. Which brings us to 3 important terms that could affect your drug pricing. And even if your medication is on the list, there might be some extra rules you need to follow. Generally, this won't apply towards your more common medications like your generic drugs, but some of your more costly medications may fall into these 3 common terms, which is why it's important to know and understand this when enrolling in your plan. The first term is step therapy. Step therapy means insurance companies want you to try a cheaper or older drug first and only move you to a more expensive drug if that first drug doesn't work. This can feel a little frustrating, I get it, but it is legal and is built into the plan as a cost-saving mechanism. Now, in certain circumstances, if you're changing plans and the new plan requires step therapy for your more costly medication, and if you have documented proof that the generic option does not work for you, the insurance company can actually cover that more costly medication without having to go through the process of step therapy. You'd want to discuss this directly with your insurance company if you run into this concern. A common example of this is a very popular medication my clients take, which is Synthroid. It's a very popular thyroid medication that has a generic available called levothyroxine. In most cases, if a client tells me that they're taking Synthroid, I already know that that's the medication that they need because of the allergic reactions that they can have to the filler ingredients that are included inside of levothyroxine. In this case, the insurance company will pay the brand Synthroid instead of requiring the client to take the generic of levothyroxine. In some cases, you may have to get prior authorization in order to get it covered, which brings us to our second term, prior authorization. It's just a fancy word that means your doctor must ask the plan for approval before the plan will actually pay for certain medications. So for example, let's say you've been prescribed a newer medication for diabetes, like Ozempic. The pharmacy tells you, we've sent your request to your doctor to get prior authorization. We have to wait before we can get that medication filled. The doctor then needs to send the medical notes explaining why that specific medication is necessary as opposed to a cheaper, more affordable option. Again, the reason for this is to help insurance companies manage costs. But without this step, your medication may not be covered and you'll be staring at a $1,000 bill for that prescription. Now, although I don't agree with all this red tape related to prescription coverage, I understand the importance of explaining this to you. which brings us to our third term of quantity limits. Some medications have limits on how much you can get in a certain time period. For example, let's say your doctor prescribes 2 inhalers per month for your asthma. Your plan might say we only cover 1 inhaler every 30 days. And even if your doctor wrote the prescription, the plan controls how much they're willing to cover. If you need more than the plan allows, your doctor may need to file an exception. And if approved, your plan will then cover that prescribed quantity. I know this can all sound frustrating, but that's why it's important to make sure when you're shopping for your plan that you confirm that your medications are not only covered, but covered well. So what should you do? Here's what I recommend to all of my clients and what I do when I'm assisting you. First, I always check the plan's formulary before enrolling. Second, ask, is my drug covered? What tier is it? Are there any restrictions? Let us run a full medication comparison and we'll show you which plan covers your medications at the lowest cost with the fewest headaches. Because honestly, it's not just about coverage, it's knowing about the fine print so you can avoid surprise copayments, denials, or pharmacy delays. If this video helped clear up how formularies work, give it a like. It helps more people find this kind of honest guidance. Medicare rules are always changing, so being subscribed to the channel will help you stay up to date as changes are introduced. If you need some help shopping for your drug plan, there's a link in the description below to schedule a call. Our help is free and unbiased. We'll be happy to walk you through the process in comparing plans. Medications don't have to be mysterious, and you shouldn't have to figure it out alone. If you got value from this video, consider watching the next video here. You'll learn even more ways to protect your wallet and your health. And until then, take care. We'll see you in the next.